The only effective way is stopping transmission. How do you stop transmission? By knowing, you can't stop it if you don't know where the virus is. By identifying where the virus is, how do you do that? By testing people frequently.
Quebec's health department said Thursday it plans to make more use of rapid COVID-19 tests, less than a week after the province's health minister told reporters that they were unnecessary. The decision comes after a report by a committee of 30 experts commissioned by the health department recommended prudent use of the tests. On the same day, 200 scientists published an open letter calling on Quebec to make more use of rapid tests as well.
You are not able to protect your community if you don't know where the virus is and who are the silent infectors, because more than 80% of people are silent infectors. They're not symptomatic.
Since the fall, COVID-19 cases and deaths in Quebec have been on the rise despite the partial closure of businesses and restrictions on gatherings. The province is currently under lockdown and has imposed a curfew from 8 p.m. to 5 a.m. until February 8th. But scientists say none of these measures have helped. In their open letter, they asked the government to put the 1.2 million rapid tests that had been sitting in a warehouse to use, tests that could provide results within 30 to 40 minutes. Public health agreed, but officials warn they could be less accurate than laboratory tests Quebec currently relies on, and that more than 80% of tests conducted in the province have results within 24 hours.
You could use the PCR test to confirm infections when people are symptomatic, but you could also, in schools, in long-term care facilities, in factories and manufacturing that have to remain open because supply chain depends on it. You could provide these tests on a weekly basis to these institutions, have them routinely check their employees.
The founder of COVIDEcolequebec.org, a website tracking the number of COVID cases in schools, says he's co-authored a study showing the risks of in-school transmission and insists rapid testing would help protect our children.
So when the government says that the main source of transmission is at home, they're not wrong, they're right. It's at home, but the source of it, in the case of young children, it is mainly coming from school.
Public Health says there are ongoing pilot projects with rapid testing in 2 Montreal high schools, and they plan to continue to evaluate their use in the education network.
The hospitals are at the breaking point, literally. And why wouldn't you want to use that? What do you have to lose? We are paying a very, very dear price of losing a few dozen Quebecers every day.
In Montreal, Melina Giubilaro, City